Welcome back to Your Life. Thanks for joining us. I'm Dr. Anna Marie. It's that time of the show where we usually share the inspirational story of a person faced with a challenge and how they overcame that challenge to pursue a passion or a dream. Well, this week's Your Life story is a little bit different. Several years ago, we lost a very dear crew member to a silent killer called an abdominal aortic aneurysm, or AAA for short. We hope this week's story will inspire you or a loved one to catch this ticking time bomb before it's too late. Do you know what Rodney Dangerfield, George C. Scott, and Albert Einstein all had in common? Well, these famous figures all battled a life-threatening condition that's not commonly talked about or known. It's called an abdominal aortic aneurysm, AAA for short. What happens, the body's main pipeline, the aortic artery, develops a balloon-like bulge right below the kidneys in the abdomen or stomach area. Every year in our country, about 200,000 people are diagnosed with abdominal aortic aneurysm. Simply, if they're left untreated, these aneurysms will quietly grow until they get large enough to rupture, which can be devastating.
The death rate from abdominal aortic aneurysms is probably the third leading cause of death in males over 65 years of age in this country. It's a silent disease which gives no symptoms as the aorta grows and expands and gets weaker and weaker.
A good analogy, an abdominal aortic aneurysm is just like an old tire that has a weak spot and blisters out. If it stretches too much, it will rupture. This burst causes such a quick loss of blood. Experts say about half of patients who experience a rupture will die before the emergency team arrives to the scene.
The biggest sign for rupture is back pain. And I have a lot of patients ask me, well, my back hurts. What kind of back pain do you have? When you actually have a rupture and you're having bleeding in the back side of the abdomen, the back pain is unmistakable.
What's the best way to protect yourself or a loved one? Well, early detection of an abdominal aortic aneurysm is key. So find out if you're at risk and talk to your doctor about getting screened with a simple and painless ultrasound test.
Now, Medicare in 2007, Medicare did approve a screening ultrasound for everybody entering the Medicare program in the first 6 months they were in there. So Medicare would pay for a screening ultrasound.
Remember, if an aneurysm is caught early, you can significantly lower your risk of rupture. Your doctor may recommend screenings every 6 months to check the rate of growth. Lifestyle changes like kicking the smoking habit and controlling your high blood pressure and cholesterol levels can also help manage the condition. If the aneurysm grows to 5 to 5.5 centimeters, this is the danger zone, and surgery is highly recommended.
We're part of a study run out of Cleveland Clinic in a 60-center study where we actually did a clinical trial on repairing aneurysms between 4 and 5 centimeters to see if there was an advantage to fixing them smaller. We're wrapping that study up now after about 5 years. We've stopped enrollment and they're trying to wrap up the data, and the data's not in yet, but we're pretty much sure that we're showing that there is no significant advantage to fixing aneurysms less than 5 centimeters at this point.
The gold standard procedure up to about 10 years ago was open surgical repair. This major procedure requires a large incision from the chest down to the groin area and a hospital stay for over a week and weeks of rehabilitation. The good news is there's now a minimally invasive procedure called endovascular aneurysm repair that requires only 2 small incisions in the thigh. The hospital stay, only 24 to 48 hours.
We still put the same synthetic tube in to replace the aorta, but now we're able to put it in and anchor it in with stents rather than opening and suturing it in.
Since the procedure is less invasive and more patient-friendly, it's offering some patients a second chance at life.
We used to have to disqualify a lot of these patients years ago because of the heart problems they have or the lung problems they have, where now we can still operate on those folks and repair them and give them a longer lifespan.
Right now, there's 1 million Americans walking around with a AAA and they don't even realize it. If you're a smoker, if you have a family history, if you're over 60 years of age, talk to your doctor about a simple, painless ultrasound test. It could save your life. We'll be right back. When we come back, we're in the kitchen with our chef for this week's Eat Well, Live Well recipe. We have a fun trivia question this week. If you saved all the skin you shed in a year, would it weigh as much as a tennis ball, baseball, or basketball? The answer when we come back. This segment of Your Life is brought to you by Atlas Foot Alignment Institute. Align your feet, align your life.